Hello again, everyone. I'm Dennis McCarthy with Upper Allegheny Health System and Olean General Hospital. Welcoming you to another edition of Inside Olean General Hospital, our news and information program about Olean General Hospital, its people, and its services to the community. With me today is President and CEO Tim Finan, President of Upper Allegheny Health System and Olean General Hospital. And today we happen to be in a kind of unusual location. We actually are inside Olean General Hospital. This is the Interventional Cardiac Catheterization Lab at Olean General. Welcome, Tim.
Thank you, Dennis.
This is a very, very special place in our building. And this is a brand new program, a year old, if you call it brand new. We've been open a year on October 1st. And, you know, there's been a lot of talk about why we put this program into play, why it's here, and what was the reason. And we have some great stories to tell, but what we want to start out with today is why did we felt we needed to have this lab at Olean General?
Well, Dennis, it's a good question, and it really starts with why do we exist as a hospital? And we exist as a hospital, obviously, to respond to the healthcare needs of the community we serve. And our community is 110,000 people, not just Olean, but our service area goes all the way out to Catheterization and Little Valley, halfway out into Allegheny County, all the way north to Delavan. So it's a big area. But our region is characterized by some of the highest incidence of cardiovascular disease in New York State and a very high rate of cardiac mortality. In fact, it's the highest in the state. So to the extent we exist to respond to healthcare needs in our region, we came up with developed the Interventional Cardiac Cath Lab. Now the issue is that these are very, very difficult to get approval for in New York State. The New York State Department of Health is very, very zealous in terms of allowing the development of these services. So they're really very, very few in rural communities. So we're very lucky here in Olean.
You know, and this didn't happen overnight.
No.
And I think it's been part of a vision that you've seen for this hospital for quite a long time, because worrisome about having to take people to far places in order to get services that save lives. So talk to us a little bit about how we wound up having this lab here. We have a partner.
Right, we have a partner, and it's Catheterization Health, upstate New York's largest provider of cardiac services. The regulations in New York State, the health regulations, allow cardiac catheterization labs to be jointly sponsored by more than one hospital. So essentially what happened is Catheterization took a lab offline from Buffalo General, disassembled it, reassembled it down here. Olean and Catheterization Health created a partnership to sponsor this laboratory. So I think the beauty of it is Olean benefits from the expertise and wherewithal of the largest provider of cardiac services in upstate New York, Catheterization Health. And, we have a lab that, again, was transferred down here. So the state is happy because the complement of labs stays constant. And we're able to respond to a really acute need down here, and that is cardiac care. Now, you mentioned about prior to this lab, patients having to be transferred to Rochester or Buffalo or other distant cities. And, as we always say, and as you know, time is muscle when it comes to cardiac. And 85% of heart damage is done the first hour after a heart attack. So it's critically important that you're able to get in very expeditiously to open up or reperfuse those coronary arteries and save the heart. And that's what we're able to do by having something here locally.
You know, and we've got another partner in this, another very important element that I know, very proud of. First of all, we also have a chest pain center here at the hospital. But talk a little bit about the emergency medical services providers in that.
Well, they've been phenomenal. In fact, the program wouldn't be nearly as successful without their expertise, their collaboration, and their support. We've worked with them such that, right from the field, they're able to send us EKGs right to our hospital or right to our cardiologists on their smartphones so that people know immediately what we're dealing with, and we can activate the cardiac cath team well in advance of a patient's arrival here based on those transmissions of EKGs and other clinical information from our EMS professionals out in the field.
So basically what we've been doing has been cutting time.
We've absolutely been cutting time, and so the pre-hospital work is every bit as important as, you know, what goes on here. So.
You know, I know we've got some great stories, and a little bit later in this show we're going to be hearing from a gentleman by the name of Ed Ribas from Dresser-Rand, who was a patient here not too long ago, and he's going to give us a little clip on his story. But you know, there's more stories that we hear every day about the great service and the wonderful team that we have here at the hospital. But 600 patients were seen. 600 in 1 year.
600 patients, 600 procedures. We initially estimated, and we were a little conservative, but 250 the first year, 250 procedures. In fact, you know, we did 600, and there is absolutely no doubt, and this isn't to sound dramatic, but lives were absolutely saved. There were many patients who had emergency procedures, and had this resource not been here, this capability, they wouldn't be with us today. And so and they're doing fine. And that's what's so rewarding about this program. It is saving lives. And yes, it happens to be at Olean General, but it is a regional resource. Because, you know, the first sign of chest pain, people need to get to a hospital quickly. And to the extent there needs to be an intervention, we're blessed that it's here at Olean General.
So, and I guess the message, even though we'll be talking to Dr. Chris shortly, chest pain, don't fool around.
Don't fool around, don't wait.
Don't wait, and get to this hospital, especially down here in the southern tier, in this region, because we've got the ability to find and fix it.
Right, it's the only catheterization lab in all of southwestern New York, all the way from Jamestown all the way out to Elmira, where we can intervene. When we find a blockage in the coronary arteries, we can do something about it. And that's really significant.
The other thing we'd like to mention before we take a break, we also got an accreditation recently, and maybe we can talk a little bit about that. We're now a accredited PCI hospital.
Right. Well, we have, you know, we got our chest pain center accreditation last year, and then this year, because of the ability to do interventions, we got reaccredited, given that capability. It's very unique. There are only 9 or 10 hospitals in the state that have this accreditation. It's the interface between our emergency room, our chest pain, and this lab, and it's slick, it's well done, and we're very, very proud of that accreditation. Again, when somebody comes in with chest pain, it's essential that we diagnose what's going on quickly. And we have cut our EKG performance and interpretation times from an average of 26 minutes to 6 minutes, and our troponin test, which is the definitive test to determine whether you're having a heart attack or not, from 90 minutes to an average of 26 minutes. Those are world-class metrics. Nobody put a gun to our head, said we had to do it, and I'm especially proud of this. We don't get reimbursed anymore for it. But it's a better system, it's a better approach, and I'm really proud of the staff here, the medical staff, the EMS community that made this possible. And I'll say this, and you can tell I'm excited about this program and all that's been accomplished. This community should feel completely confident and secure that, you know, if they or any of their loved ones, anybody in their family, has chest pain, it's going to be diagnosed quickly, and it will be appropriately dealt with here at Olean General Hospital.
You know, and I'm sure that many of the emergency patients that we call STEMIs, but people that had to come in right away because they're having a heart attack,
right,
they would understand that really well.
Right, and they've been effusive in their praise and their thanks and their appreciation for Dr. Malavarapu and his nursing team and the EMS community and everything they've been able to do.
Do we miss anything?
I think so. We have red lights out in front of the hospital again.
What are they for?
Well, again, just to celebrate, you know, the 1-year anniversary, both of our chest pain center accreditation and our 1-year anniversary for the lab.
Yeah, the lights are out there. They'll probably be out there till Valentine's Day, maybe?
Maybe, yeah.
Maybe so.
I think so.
And it looks pretty, and it's early, but the red lights are up. And again, it's a credit to not only 600 patients, but a whole bunch of people here at this hospital, up in Buffalo, EMS throughout our community. Tim, congratulations
Thank
on
you.
a great program. Thanks for being with us.
Okay.
We'll be back in a minute. Welcome back again, everyone. We're here in the Interventional Cardiac Catheterization Laboratory at Olean General Hospital, and our guest for our second segment is Dr. Chris Malvarapu, the interventional cardiologist who runs this laboratory. Dr. Chris is from Kaleida Health, Gates Vascular Institute, and is part of the cardiac cath team here at Olean. Dr. Chris, welcome. Thank you for
Dennis.
being with us.
Thank you.
This is quite a place. You've had, in the first year of operation, 600 patients in here, and they all have been under your care. Is that correct?
Yes, almost all of them have been under my care. Sometimes I have other doctors covering me, but
So what happens in here? This is really the core of everything we do in cardiac catheterization. People come in here and tell us a little about the experience. What happens?
this is primarily a cardiac catheterization laboratory, which is used to evaluate patients electively and emergently. So we're both what we would consider a diagnostic lab and a therapeutic lab. So a lot of our patients come in, electively, and a significant amount of them also come in urgently. So the elective patients, we do elective angiograms. A lot of times we do it from the wrist, the radial approach, and we look to see if they have any significant arterial blockages. And then probably if they have arterial blockages, a lot of them are treated medically. Percentage of them will have stents put in. Another percentage will have to have heart surgery.
Let's step back just a second for folks who don't know what is a stent? What does that do?
A stent is a cylindrical metal tube, usually with a coating on it, to clear up arterial blockage, which is restricting blood flow. So.
And it gets inserted.
It gets inserted through the tubes that are put into your body.
Opens up the.
It'll open up the blockage. Yes.
How big are these?
The stents are not very big. They're like 3.0 to 4.0. And in terms of they're tiny arteries.
Smaller than the tip of that pen.
It's like a ballpoint. It's like the spring of a ballpoint pen, if you can use that analogy.
Because I think there's people don't understand. When you see these big graphics of what veins look like, they're always big because they're what the actual size is. They're not very big.
No,
they're
they're about
small.
an inch, inch and a half.
You do them through the wrist, and you do most of them through the wrist.
We probably do about 70% of our cases through the wrist, sometimes even more. And usually, a lot of advantages to doing it from the wrist, mainly because in terms of patient recovering the patient quicker, and also in terms of complications, you have a lot less bleeding complications, and the patients can heal faster, leave the hospital quicker.
So let's say you have an emergency case, which we call a STEMI, which is basically our term for heart attack, and you got to take care of it right away. Now, people get here. We talked a little bit with Tim Finan about closing the window, time is muscle, and how we reduce the time. You now get an EKG in many cases from the EMS providers in the field, and by the time that patient gets to the hospital, you already have the information you need.
That's right. A lot of times, the hospital here and the EMS services here and the administrators here have done an excellent job of getting these rapid mobile EMS agencies to do a 12-lead EKG very quickly. And if the patient is having what we would consider an ST elevation in an emergency, the EKG is automatically transmitted to the iPhone. And then we have one call which activates everybody. And within 20 minutes, a lot of times the entire team is here. The cardiologist is almost always on site. And the patient is on their way by the EMS, brings them in, and they go right to the cath lab. They don't stop in the emergency room. and the artery is opened up very quickly. So a lot of times, by the time that the patient has first seen the EMS provider to the time the stent is put in, it's a lot of times will be under 60 minutes.
And I know that that's the subject of great pride here at this hospital, because we talked earlier about what we call performance, and that means how quickly and efficiently. And I believe the team here believes they're performing at a national benchmark standard, which means we're doing as good a job here in many ways as some of the larger hospitals in larger cities.
Oh, definitely. I think the team here is very, very good. I think that it's a very experienced team. The idea is that time is muscle. Most of the heart attacks, most of the deaths which occur from the heart attack occur within the first hour, and that's why it's very critical patients do call EMS, and the EMS agencies can respond right away, and sometimes, if you have a terrible rhythm, they will shock you right back and bring you right over. And so in terms of what we can offer is we serve a large amount of people within an hour radius of here, and a lot of those people, if they're having a heart attack, Olean General is the place to come because of the fact that we have a laboratory which can fix the problem immediately. So you don't have to necessarily be helicoptered out of here or all those other things that they used to do in the past. So all those things are in the remote past.
So yeah, and I know we've been spending a lot of time talking with EMS folks over the last year since the lab opened, but I think maybe at this point the message really needs to generate to the general public, and then maybe it comes down to the bottom line. What are the signs that if you're having a heart attack, what are some of the signs people should look for?
Well, I think the classic signs, Dennis, as we've mentioned before, are, discomfort in the mid-sternal area and the chest area, classically going up the neck and jaw, going down the arms. That's the classic symptoms. And men and women both will have symptoms. Women, though, sometimes may present with a little bit more atypical symptoms: indigestion, fullness, sweating. All those things would be associated. You just have to have a high index of suspicion. But it's very important to, if you think you're having a heart attack, if you have any of those symptoms, to call 911 right away. And the EMS providers have been excellent in responding to them and bringing them here very quickly.
A lot of times people feel, oh, I'm having indigestion, so I'll feel silly if I go someplace, and it's just, they shouldn't.
No, they definitely should not. Okay. I think the goal is to call the 911.
So you've had a great year, first year of success here, and I call success basically meaning you've done a lot of good work with a lot of good people, and I'd like to take a time to congratulate you and your whole team and the EMS community on doing such a great job for the people that are down here. And thank you for being with us today, Dr. Chris.
Thank you, Dennis.
We're going to take a minute and take a look. One of Dr. Chris's patients was a gentleman by the name of Ed Rybitz, who was on this table not too long ago, and he had a few things to say when we interviewed him about his experience, what happened to him, and why he got here. Just take a listen.
My name is Ed Rybitz, and I live here in the Olean area. I work for a local company called Dresser-Ran. With my profession, it seems that lately I do a lot of traveling. A lot of traveling not only in the United States, but abroad. I came back from a trip abroad, and when I went to run at the YMCA, I found that I was only able to run about a block. After that, I lost my breath. I went to my local doctor. That's how I came to meet Dr. Cox, my cardiologist. He had recommended that I have an angiogram, catheterization. And in fact, he had recommended that I come here to Olean General Hospital. Ultimately, not only did they do a diagnostic, but they also had to put in a stent. And I have to admit that I was very pleased with the professionalism and the way that the whole experience went here at Olean General Hospital.
So there you have it. Ed was one of many patients that had emergency reasons for coming to this hospital, and thanks to Dr. Chris, his team, and emergency medical services providers around the region, it's making a difference in saving hearts and saving lives. I'd like to thank everyone for being with us today. If you'd like more information on the heart program at Olean General Hospital, just go on the web at ogh.org. Thank you for being with us.